As you can see here, the markers have improved significantly with the new treatment plan.
Oh, that's wonderful.
Yeah.
You're in good hands now. Try to rest. I know this is hard. Just try to breathe with me. You're not alone.
Many seniors are unaware that these routine checkups could be doing more harm than good, leading to unnecessary treatments.
New studies reveal that up to 37% of medical tests in seniors.
When considering a medical scan, understanding the statistics is vital. Here at Senior Secrets, we help you navigate the data.
One of these checkups, the number 1 on our list, actually causes 5% of all cancer cases in the US. O, which is equal to the number.
Breathe deeply now.
Okay. And again. Sounds clear.
Each scan delivers between 10 to 20 millisieverts of radiation, which is equal to around 500 chest X-rays.
That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's T.
Spectrum. That's not just counterproductive, it's terrifying. The scan can detect harmless nodules, glistens, or cysts.
But the moment they are seen, a red flag goes up. More scans follow, then biopsies, then plu. Let me tell you about Marcus, an
active 80-year-old who used to teach martial arts to younger seniors. He felt.
All right, deep breath in.
We found a tiny 3mm lung nodule, but it looks fine. All for something that could have been left alone. Experts now advise that full-body CT scans should never be used for general screening in asymptomatic adults. If there are symptoms, like unexplained weight loss or visible swelling, then targeted imaging makes sense.
The sagittal view confirms the initial diagnosis. We're looking at a stage 2 glioma right here.
The damage could be worse than what you were trying to avoid.
A safer, smarter approach is listening to your body. I know regular checkups are important, but sometimes it's hard to make the time.
You have to value your time, energy, and health above all else. Good hands.
Your time, energy, and health are too valuable to waste on fear-driven screening that could leave you worse than where you started.
Health checkups, what to avoid after 70. Modern medicine is powerful, but it's not perfect. Sometimes less is more.
Always ask, what happens next if this test finds something?
If the answer is unclear, or if the risks are higher than the reward, it may.
And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's talk about the first test swab.
Now, we want to hear from you. Have you or someone you love
Now, without any further ado, let's talk about the first test, why it looks harmless but could quietly ruin your quality of life. It sounds harmless, a quick scan, no pain, no needles, and you walk out knowing whether your bones are at risk for fractures. But here's what no one tells you. Past the age of 70, a bone density scan can often create more fear than benefit. This scan.
But in older adults, especially women, the results almost always come back showing lower density, even when there's no.
That's because bone loss is a natural part of aging. Just like wrinkles or gray hair, it happens to everyone.
And yet, healers are pushed into taking medications like bisphosphonates, which are supposed to strengthen bone. They are supposed to strengthen bones, but come with serious side effects like jaw necrosis, which is a rare condition.
Studies have shown that treating mild bone loss in people over 70 with medication has little to no impact on actual fracture rates.
A study published in the Journal of the American Geriatric Society followed over 1,200 women over 70.
Bisphosphonates reduce fracture risk by up to 50%. That's not nothing, but it's far from ideal. That's not nothing, but it's far from life-saving. Instead, those women were far more likely to suffer from medication.
Her doctor immediately started her on alendronate, which is a bisphosphonate. 3 months in, she developed severe reflux and jaw pain. 3 months in, she developed severe reflux and jaw pain. Staying active with resistance training helps maintain mobility. Combined with a healthy diet rich in greens, you can age gracefully.
Here you go, dear. Try this.
Oh, that's wonderful. Just like you.
Significantly reduce fracture risk, according to a 2022 Osteoporosis International study.
Don't let a number on a screen scare you into treatment you may not need.
But there's one scan that can lead to something even scarier: brain surgery. And let's talk about that next.
When seniors feel more forgetful or confused, the natural impulse is fear. Fear of dementia, fear of Alzheimer's, so doctors often respond by ordering a brain MRI. But here's the
But here's the uncomfortable truth. MRIs, which are detailed scans that show the structure of the brain.
As you can see here, most MRIs in people over 70 simply show age-related changes,
meaning slight shrinkage or white matter. The scans confirm a high-grade glioma. We need to schedule the resection immediately.
We're clamping the vessel now, doctor. Keep the suction clear.
The atrophy in the hippocampus is clearly visible here. This explains the memory loss patterns we've been tracking.
Yes, the correlation is striking.
86% showed some form of brain abnormality, but only 3% of those findings were linked to an actual.
It's okay, just breathe. We're here for you.
Biopsy scan, analyzing for signs of invasive procedures like spinal taps.
Nearly 12% were sent for invasive procedures like spinal taps or even exploratory biopsies, all based on vague scan results.
He panicked, convinced he had dementia. He stopped driving, stopped going to church.
Look at this section here compared to the baseline.
It's progressing faster than we thought.
I'm so glad we started the program.
My memory hasn't been this sharp in years.
MRIs are useful for showing, for example, structural changes in the brain. A better first step is a cognitive screening test.
A better first step is a cognitive screening test, which is a simple paper-based exam that evaluates memory,
Operate static dudes, rates to your left. Long trend and spike leading dot.
Now brace yourself. The next test on this list is one you've probably had multiple times. It's number 3. It's one of the
rapes, especially when used on people who don't have any clear signs of heart disease. That's because it can lead to false alarms and unnecessary.
The problem is in the accuracy. Studies show that in adults over 70, the false positive rate for stress tests can be as high as 40%. That leads to follow-up tests like angiograms,
A study found that over half of all placed stents were in patients with no real symptoms or benefit.
Okay, your vitals look good. Keep going.
While staying active is important, listen to your body. Fatigue during daily activities might signal a need for a
which is a test that inserts a tube into the arteries to check for blockages. A mild narrowing was found, and a stent was placed. The patient experienced a severe reaction requiring hospitalization and extensive follow-up care. This often leads to persistent fatigue.
If you're over 70 and not experiencing classic cardiac symptoms, like chest pain during activity, shortness of breath on
exertion, or a significant drop in energy during light exercise, then a stress test may do more harm than good.
Or even a coronary calcium scan, which is a low-radiation imaging test that shows whether dangerous plaque is building up.
Almost never recommended after 75 unless there are specific symptoms. The risks go up with age. The preparation is harsh.
Involving strong laxatives that can cause dehydration, dizziness, or kidney issues.
The sedation used during the procedure poses added risks to brain function in older adults.
According to the JAMA study, they followed over 1 million Medicare patients 70 and older.
Right, and the key takeaway is the efficacy rate per 1,000 procedures.
They found that for every 1,000 colonoscopies done in patients over 75, the only to that for every 1,000.
That's a 10-to-1 risk-to-benefit ratio. And even when polyps are found, many are small and slow-growing, removing them in an older ad.
Dina was a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding.
She agreed. During the procedure, a small polyp was removed and that night, she experienced intense abdominal.
At the hospital, they found a bowel perforation. She spent 9 days in recovery, lost 10 pounds, and when we reviewed her case, we found she had already had 2 clean colonoscopies in the past. There was no reason to repeat it.
The U.S. Preventive.
The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people.
The second-generation FIT. It detects blood and stool, is highly accurate, and non-invasive. Or as preventive services in private clinics are marketed as a way to catch cancer early. But here's the shocking truth.
For older adults, especially over 70, the risk of triggering unnecessary follow-ups, biopsies, and even surgeries